This morning, we're going to continue our long-standing efforts to lower the cost of healthcare for taxpayers and patients. Today, the committee focuses on pharmacy benefit managers, in particular the new strategies like charging administrative fees tied to the price of a drug that these multi-billion-dollar corporations have aggressively adopted in the last 4 years since we had previously looked at PBMs. Pharmacy benefit managers had a strong case for themselves back in the 1980s and 1990s. The original goal was to use their access to limited data to negotiate lower drug prices on behalf of their citizens, on behalf of their clients, insurance companies, and employers. When prescription drug coverage came to Medicare with Part D in the 2000s, PBMs shifted into overdrive to get to a larger market and more sophisticated drugs. In recent years, it's been increasingly apparent that PBMs are using their data, their market power, and their know-how to keep prices high and pad their profits instead of sharing the benefits of the prices they negotiate with consumers in the Medicare program. I believe this is an industry that is going in the wrong direction, and that's having a big impact on the prices that Americans pay at pharmacy counters from one end of the country to another. There are especially serious consequences for the federal health programs that the Finance Committee oversees. Between Medicare, Medicaid, CHIP, and the individual health insurance market, the committee oversees health coverage for more than half of all Americans, or roughly 180 million people. Prescription spending for these Americans constitutes a significant portion of the amount the United States as a whole spends on pharmaceuticals each year. That totals $577 billion in 2021. That's why it's so critical for the committee to examine what needs to be done to modernize the rules of the road for PBMs.